are those people running around the hospital with an iPad? What is a child life specialist? And what can they teach us about communication, not only with children, but with each other? Learn the answer to these questions and many more in this episode of the Talk to Me Doc podcast.
Welcome to the Talk to Me Doc podcast, where it's all about communication among the entire healthcare team. Let's talk to each other more effectively so that we can truly help our patients. And now your host, Dr. Andrew Tisser.
Hey guys, this is Andrew. Welcome back to the Talk to Me Doc podcast. If you've already subscribed, thank you so much. If you're new to the show, please hit subscribe because today, like with every episode, I bring to you the best guests from all around healthcare to discuss communication and how we can fix it. Today, I have a special guest for you. This interview is really a treat. Brielle Swerdlin earned her Bachelor of Science degree from Utica College, where she majored in psychology, child life. After working in the field of child life for a few years, she completed her Master of Science degree in Healthcare Administration from Colorado State University Global. Brielle joined the child life team at Upstate Golisano Children's Hospital in Syracuse, New York, 5 years ago after working as a one-person program at Edinburgh Children's Hospital in Edinburgh, Texas for 3 years. Currently, Brielle provides services to patients in the Pediatric Emergency Department at a Level 1 trauma center in New York that serves patients in 17 counties from the Pennsylvania border to the Canadian border. This past April, Brielle had the honor to present at the Association for Child Life Professionals National Conference with her coworker on the collaborative program they began with the Onondaga County Medical Examiner's Office. Professionally, Brielle's interests include bereavement, trauma, children with special needs, child abuse, and trauma-informed care. Brielle has really enlightening view on team-based communication. She has an uplifting personality that you would expect for someone that deals with children. Brielle has taught me many things over the years, and I credit her with many improvements to my practice. Well, enough of me. Let's welcome Bri onto the show. Hey, Brielle Swerdlin, welcome to the Talk to Me Doc podcast.
Thank you, Dr. Tisser. I'm excited to be here.
Awesome. All right, Andrew, from now on, let's just get rid of that from the beginning. So I already recorded a little intro about you based on your bio, but if you could give the listeners a few sentences about who you are, what you do, and all that.
Yeah, so my name is Brielle Swerdlin. I am a child life specialist at a Level 1 Pediatric Emergency Department in Central New York. And as a child life specialist, I help kids and their families with the fear and anxiety of being in the hospital, providing education, preparation, and of course, play to our kiddos, helping them get through their hospital process.
Yeah, I remember when I was training, that's how Bri and I first met at Upstate in Syracuse, that it was really nice having a child life specialist in the Pediatric Emergency Department. I mean, I still miss Buzzy the Bee.
Yes, Buzzy is a great tool that we have. Buzzy vibrates, for those of you who don't know, near the area where we do an IV start or an IM injection, and it works on gate theory. It was created by Dr. Amy Baxter, who is a pediatrician. And so we use Buzzy a lot for a lot of our procedures, IV starts, IM injections, digital blocks, things like that.
Awesome. So if you could explain to listeners a little more, what is child life? Where did it come from? How you got interested in it?
Yeah, so child life has been around for 30 some odd years. Some people may know us as the Play Ladies. That's kind of what it started like back in the day. Emma Plank, thank you for starting our career. And so what it is basically we help the kids get through the hospital process. I wanted to work with kids, but didn't want to be a teacher. Sorry to all the teachers out there. Shout out to you. You do great work. Just wasn't for me, but still wanted to work with kids. Started down a different healthcare path working with kids, and that wasn't for me either. So I decided to see what my college had and what my institution had, and scrolling through their website of possible majors and came upon child life, read the description and said, yep, this is what I'm going to do. So started from there. It's a pretty cool field. I get to work with kids. Child life kind of is in all sorts of different atmospheres, both in traditional settings like the hospital and in some non-traditional settings, which is pretty cool that we've had the ability to branch out. And so the team I work on is currently 13 child life specialists at our hospital. So we have child life specialists in the outpatient setting, surgery, radiology, of course, the emergency department where I work. And we also have child life specialists in the inpatient setting, so on all of our inpatient pediatric floors. So it's pretty cool. It's we definitely have a unique role with the healthcare team. We do a lot of supporting and advocating for our patients. We are not medically trained in the sense that we did not go to medical school like that, but we are trained in psychology, child development, with a very good understanding and training in the healthcare system. So it's a pretty unique field, but I think it's the coolest. Not only do I get to see really awesome things in the hospital and with our patients, but I also get to do arts and crafts and play video games. So it's a pretty cool field.
Yeah, I mean, playing video games at work would be really fun.
Yes, it is some days until I'm too competitive and I lose the games,
Well, the kids are probably a lot better than I would be right now.
Oh, I've never played a video game until I started my job, so I always lose, but my competitive streak comes out every once in a while.
So, Brie, this is a communication-based podcast, and it really is focusing on communication within the greater healthcare team. You're the first person that I have on the show that deals exclusively with pediatrics. How do you think communication is different in regards to pediatric patients, parents, and their interactions with the rest of the team?
I think something that makes working with the pediatric population different than working with the adult population is that with the adult population, your primary goal is to focus on talking to the patient themselves. They're the ones receiving the care. Now, occasionally, you probably have to talk to their family members if they are unable to make their own decisions, or if they bring their family members to their appointments, but your gear is to talking towards the patient himself. In pediatrics, we're not just talking to the patient. Until the patient is 18, they can't decide their medical treatment by themselves in most cases. And so we have to do a lot of talking to the families and explaining what has to happen. But we also have to be mindful of providing that family-centered care and talking to the patient, because they're the one who's having everything happen. So communication in pediatrics has to be multifaceted. So we're communicating with the patient, but then we also have people like myself who work to advocate for the patient, who have to communicate with the medical team. So there's a lot more of a communication dynamic, in my opinion, in pediatrics, with who needs to be discussed with what and all of those pieces to make sure that you're providing the best healthcare process to the patient and their family.
Oh, that makes sense. And you touched on advocating for the patient with the rest of the team. Do you ever run into challenges, whether that be approaching providers or maybe being dismissed as a member of the team just because you're not medically trained?
I definitely think that has the very big potential to happen. Every facility is different, and everybody's training as a provider in that medical team is different. And if you've never been around a child life specialist or a situation where you've had somebody advocating for the patient that is not maybe their family member, it can definitely be a little unique. In some situations, you're working in a teaching institution where the new residents and the specialty residents have never heard of a child life specialist before. And their goal is just to get the work done so they can see the next patient. And sometimes that can make advocating for the patient or communicating with the medical team a little bit hard, because it's trying to juggle and challenge yourself to think, okay, what needs to happen right this moment? What can we advocate maybe for some pain medication, or how can we work as a team to provide a better experience? And sometimes the providers, the doctors, the residents, the therapists, they don't have that experience thinking that way for the patient. And so yes, it's definitely easy to be dismissed in this field. And it takes some getting used to learning how to advocate also for yourself as a professional to be part of that medical team to make decisions.
Well, that makes a lot of sense. Do you have any advice for maybe not only child life specialists, but other members of the team that maybe are having difficulty being recognized or being dismissed as such, just based on your own experiences?
Yeah, everybody in the medical team, and I view the medical team as more than just the doctors and the people providing direct care. The medical team is anybody in that institution. So anybody in your institution is part of your team. And it's really important to remember that as well when you are trying to be part of that team, and recognizing that other people don't necessarily think that way, and other people haven't had the same experiences that you've had or don't have the same background. So for me, it's very easy for me to think about why a kid might react a certain way. But I have an education in child development and in psychology, so I understand why kids might react a certain way to a procedure or to information about a diagnosis. But new residents, new doctors, doctors who haven't had these experiences, therapists, anybody else working with this patient might not have had those same experiences to understand why a kid might react a certain way. So providing information, being honest, explaining why you feel a certain way, and then not holding it against people if they don't view your viewpoint as one that should be followed is really important. You're likely going to have to work with these people again, and you don't want anybody to feel resentment towards you, and you don't want to feel resentment towards anybody you have to work with for other patients and for the best care provided to the patients and their families.
Yeah, that's great. I mean, that what you're saying, I mean, that's the whole purpose of the show, is to explore communication within the greater team, including everybody, not just the doctors and physician assistants and residents and everybody. Do you feel that being at a teaching hospital makes your job easier or harder?
It's a little bit of both. I feel that sometimes working in a teaching facility makes my job easier because my residents that I'm working with, my nurses that I'm working with, they recognize that we're in a teaching hospital. There's a lot of discussion happening with the team. And so me imparting some of my knowledge from my understanding of working with children is really viewed as something that's super beneficial. At the same time, working in a teaching facility, that rotates the people that I work with on a pretty regular basis. And so it's a constant game of restarting that teaching process for me as well. While I'm not directly providing their education, sharing my knowledge and sharing what I know about working with kids and their families really helps them learn. But I have to start that new every year. Every year we bring in new staff, and the learning has to start again. And because of that, it can make it really hard to advocate for your patients. What you may be advocating for at the end of June changes when you start advocating in July, and you have a whole new set of student doctors and student therapists and student nurses who are learning. Now you have to start again. You have to explain why these things are super important versus what you were doing a few days before with residents who already had been learning from you for a year. Then to them you say, oh, I think this patient would do better with X, Y, and Z. And they're like, oh, yes, because they've learned from you already and they've seen the difference it makes. So there is definitely a challenge in working at a teaching facility, but it's something that I find great because now I can share my knowledge with these new providers and help them see what is out there, what they can use in the future.
Absolutely. Yeah, I mean, I always remember some of the interactions we had, and this was years ago now, and I think I carried that forward into my own practice. I always thought we had a good rapport. I mean, correct me if I'm wrong, but how do you go about establishing that rapport with new, whether that be residents, students, nurses, or anyone you're interacting with who's like, well, who the hell is this person, you know?
Yeah, well, I do agree. We did have a great rapport, but I think part of building that rapport is recognizing that we're all there for a professional reason, but we're all humans and we all have pieces and insecurities and nervousness about learning and about growing as professionals. Just because I have this degree doesn't mean that I'm 100% know everything in my field. And so I'm still constantly learning as well. And so recognizing that we're still all in this learning piece and just trying to be a human with your coworkers. And yes, there are definitely professional boundaries that there have to be maintained, but recognizing that we're just trying to do what's best for the patient, and keeping the patient and their family in mind helps you build that rapport. And then chatting with people when there's some downtime, figuring out people's likes, dislikes, just being friends and being friendly with people, that helps build that rapport. when we first started working together, Andrew, you probably were like, who is this lady over here? Why does she want me to let this kid lay in this really weird position for this lac repair so that they can play on the iPad? What does this mean? But then with doing it and getting to know me, you realize that, oh, maybe she's not so crazy, this lady who carries this iPad around and who wants to do arts and crafts. Maybe this could work. And we try it once, and then you're realizing, oh, maybe it does work. And then even if it doesn't work, we've still built that rapport and that relationship that, okay, so maybe it didn't work this time, but that doesn't mean it's not going to work next time. And that's the piece. It's not just get in, do your job. You have to recognize that the people around you and the people you're working with have these skills, and building that rapport and just being friendly and getting to know those people helps you to realize that just because something may not work one time, it doesn't mean it's not going to work all the time.
Yeah, it's great advice. I mean, I think it seems so simple, right? Just be a person and talk to people and get to know them. But I don't think it really happens all that much.
I agree. And I think part of that is because people are so I don't want to say self-centered, but thinking about what they need to do to get their job done so they can get on and move on with their lives, whether that be because there's some social function happening or because they want to hang out with their friends or because they want to get home to their family. And while those are great things, and like I said, professional boundaries are super important, we're still here and we have to all be together for 8, 10, 12 hours. Might as well make it useful and make it have a good time. And every person on the team is super important. And so getting to know those people helps you have a better time during your 8, 10, 12, 14, 16, whatever, 24 hours, whatever it may be. And I think that's the piece, keeping that humanity in it. And that communication is so important because I'm sorry, but I don't want to spend my 10-hour shift sitting by myself just waiting for my patient to have the need for something to do, but then not talking to anybody else. That doesn't sound fun. And that definitely isn't going to be what's best for my patient in the long run. If I don't have that rapport with the nursing staff when we go to start that IV, well, then that's not helpful because we're not going to have that interaction that where I know what my nursing staff is thinking and what they know where I'm thinking, and we're not going to provide the best interaction for that patient. But it is hard, and it is hard for some people to feel the ability to open up and really make those connections, but it's definitely something that I think everybody in the healthcare team should work on.
Completely. I mean, it started selfish for me. I'd be like, well, I don't want to be bored at work, so I'm going to talk to everybody. But over the years, I really think that it's, I mean, you know how many times you saved my butt, the nurses saved my butt, the pharmacies, the pharmacists did. I mean, it's, and that's just because we chit chat about whatever's going on, you know?
Mm-hmm. Well, and it's even more than that. And thinking about it on a personal level as well, like, I don't want to be bored either. I want to talk to everybody. I don't want to spend my 8, 10, 12, whatever hours I'm in the hospital sitting there by myself. Like, I mean, granted, I love to read, but work is not the time to be reading. And so why am I going to sit around waiting for some interactions to happen with my patients when I can be interacting with my staff? But that is everybody. There are definitely days where security is my best friend because we are working with a hard patient and security gets called. And if I don't have the rapport with the security, instead of letting me talk to patients and try to figure out what's happening or, you know, whatever, security is going to go in and do their thing. And we have to work together. When we have upset families because they've been delivered, you know, news that may not be great, there are grief reactions that happen. And sometimes they're loud and sometimes they can be a little destructive. And if I don't have that rapport with my security staff, then security is going to do their job and my job won't intermix with theirs. But if we have that rapport, then that grief reaction, maybe I can help that family channel that into a different way. And then security doesn't have to be involved because I can help the family and security trusts that I know what I'm doing. Or our housekeeping staff. I'm the lady who provides all the kids the crayons and the stickers. I mean, that just sets me up for people not liking me, especially on our housekeeping staff. I mean, I have been told many times that we can only use a certain brand of crayons because the other crayons are harder to clean off the floor, off the walls. I mean, I give kids things to make a mess. But if I didn't have that relationship with my housekeeping staff, then giving crayons and stickers just doesn't set us up for success. It sets us up for failure because I haven't expressed that I'm part of their team. I am the first one when I see stickers and crayons to walk right up to housekeeping and be like, hey, can I get the little scrapey thing so I can get the stickers off? Like, I'm sorry, I did it. Let me take it off, because we're part of a team. And so it's important to have that communication with everybody.
I agree. I mean, I think it's a refreshing outlook that you're expressing here, and really gets to the root of the show. Have you run into many challenges in your career?
Yes. The first hospital I was at, I was a one-person program. So what that means is it was just me as the child life team. And I was tasked with, interacting with so many different people. And while there were so many great things, being one person makes it hard to be everywhere at the same time. And then transitioning to a larger team and a larger facility, that also has its challenges. And being respected as a member of the team, you have to earn that respect, and you have to earn your keep, so to say, and you have to join a whole new team. I moved from a hospital where we were a staff of 500. Whether you worked in pediatrics or adults, I likely knew your name. I likely knew who you were. Now I'm at a hospital with, I think, just a nursing staff of 5,000. I don't even know how many employees are at our current hospital, and I look at people all the time in the cafeteria and I don't know who they are. And that can make it unique and interesting. And then working at a facility where we're a children's hospital inside of an adult hospital, there are occasions where we get calls from adult units and adult areas of the hospital, and they don't really know who we are or what we do. And they're asking for help and services that maybe I can't provide to them. And those can definitely be trying times when you're trying to communicate with them about why you can't help them, or what changes need to be made, or who they should be reaching out to, because they just see that there's this person here who's supposed to be able to help us, but I can't. And so those times have definitely been a little challenging, and been unique to navigate through.
Sure, absolutely. Do you you've touched on this before. Do you think that improved successful communication within the healthcare team trickles down to better patient care and outcomes?
100%. 100%. I think in pediatrics, we think about procedural planning a little bit more than in the adult world. And when I say procedural planning, I don't mean what procedure has to happen and what anesthesia needs to be used to get that done. That's not necessarily what I mean. But for something as simple as an IV or an IM injection, the medical team has to have a discussion beforehand. And sometimes that discussion, after years of working with each other, is nonverbal, or you just kind of know because you've been doing it for so long. But you have to know how you're going to approach a, let's say, 4-year-old to do an IV start. How many team members do you need? What do you need? Does this patient need a pre-medication before this happens? What options are available to you? If you don't have good communication, we're not doing our best service to the patient. There are very different ways that an IV start on a 4-year-old could happen. Things could go very, very well. We could use positions of comfort, which is the family member maybe holding them or whatever is comforting to the patient. We could be using a pre-medication. We could be using items like Buzzy or a topical pain spray or a topical numbing cream. We could be using distraction items like an iPad, an iSpy book, a little Find It tube, which is like an iSpy tube. There are all sorts of things we could be using. And so if we don't have that communication between the medical team about what our options might be for this procedure or for this situation, then are we really providing the best tools and the best process to the patient and their family? And I think that's what makes it so important. And I think in pediatrics, we do a really unique job of seeing that. In an adult, you might walk in by yourself as the only nurse or the only provider to put an IV in. Because as an adult, you can talk to them and you can say, okay, this is going to be a pinch. And then most people as an adult have had blood work done. So doing an IV is very similar, and ta-da, 1, 2, 3, it's done. But in pediatrics, it's very different. And I think that pediatrics shows that communication is very important. And I think in most places, whether you realize it or not, you're having those conversations and that communication. It's just, is it being effective or is it not?
Agreed. I mean, so what you're saying is we don't just go in there, grab the kid, tie him to the bed, and do what we need to do? I mean...
Nope, I really hope not. I wouldn't want that as an adult, so I really hope we don't do that to our kids. And I try really hard to not let that happen. Just saying.
I vividly remember being like 6 or 7 years old, needing stitches after I ran through a shopping mall for a box of Bugles and split my chin open, just being held down to the bed while they did the stitches. And it's like a vivid memory. So I'm glad we don't do it that way anymore.
I mean, that is also location specific and training specific. I also have a memory from being very young and needing some blood work to rule out some things that were going on. And nobody told me. 100% nobody told me. I think my mom might have said, like, we're going to get some tests done. But I think I was like 7 or 8. And so, like, what did that mean to me? And we get to the lab and they had me sit on my mom's lap. But then there were like 4 other people there. And then nobody told me what was happening. And I'm just sitting on my lap and they put that little arm of the chair down, right? The phlebotomy chair. And somebody grabs my arm and holds it out. And then they put this tight rubber band on. And really, other people are holding my arms and people are holding my legs. And what happened? I freaked out. My poor mother had bruises up and down everywhere. But then a few weeks later, when I needed blood work, I walked in, sat on the chair by myself, and held my arm out. Because at least this time I knew what was happening. Somebody said, you have to get a test done. I said, okay, I know what that is. And I sat down, and look at what communication could have changed for me or for you as a patient. I mean, you might not have liked getting stitches, and you might not have liked your lidocaine injection that they likely gave you to numb everything up. But if they had talked to you about it, probably would have been a little bit nicer. Same with my blood work.
I mean, in my mind, I was in like this dimly lit room with like, it's like a horror film in my mind, but I'm sure that's not what it was, but that's how I remember it because it was scared,
Exactly. Well, and that's why it's so, location specific, because there are definitely hospitals out there that don't have child life specialists and don't teach their employees how to utilize this type of communication with our patients. So at least maybe if people have communication between themselves as the medical team, maybe things can still get better. But I'm sure there are definitely facilities out there who would just hold a 7-year-old down to do some stitches.
Absolutely. Yeah, really. And a lot of that is the background of the nursing staff and how the physicians were trained. And I mean, there's a lot that goes into it, but it's things can be a lot easier or they could not be. And a lot of that has to do with communication, not only with the child, but with the parents and everyone that's there.
Exactly. I definitely agree with that.
Well, this part of the show, I like to transition to get to know the guest a little bit better. You already talked about child life and what it is and how you got interested in it. You mentioned reading, that you don't want to do it on shift, but on your downtime, what's your favorite book of all time and a current book recommendation?
I don't actually think I have a favorite book of all time. I definitely have a favorite genre. I am a sappy romance kind of gal. And I currently have 2 authors who I am loving their books. Amelia Finn writes out of Australia. Of course, they're sappy romance novels. They're good. They definitely make you fall in love. And then Brittany Sahin writes sappy romance novels that have to do with Navy SEALs. So nothing can be bad in that book.
That's very specific.
Yes, it is.
Do you ever read any nonfiction?
Not often. I feel that I work in a field that is very stressful and has a lot of, sometimes I see things that are sad and depressing. And so I like to read happy, everything ends happy types of books, just for my own, mental well-being. So not a ton of nonfiction.
Great. Oh, that's good to hear. You certainly need a stress relief after some of these crazy flu season days.
Oh, yes. Hello, respiratory season.
So, Brie, what do you like to do for fun?
I definitely enjoy spending the time with my dog. I have a 13-pound little weenie dog, who is mama's little boy and loves snuggles on the couch. I also play volleyball, played in college and have continued to keep up with that, not as competitively, but just for fun. And I enjoy just being active and having other ways to make my mind go so that way I can de-stress from a hard day at work.
Certainly needed. Now, if you could give physicians or providers in general one piece of advice in the area of communication as a whole, now it doesn't have to be pediatric specific, what would that piece of advice be?
Everybody who works in your facility is part of your team, and everybody who works in your facility has experience that you may or may not have. And so every piece of information is valuable. Some more valuable than others, but those pieces, all of that, those relationships will build to provide a great healthcare experience for your patient. So if the housekeeper suggests that you don't use a certain brand of crayons, then maybe you're not using that certain brand of crayons because they know. If a nurse looks at you and says, based on my 30 years of experience, I don't think this is going to work, there might be a reason. If you don't necessarily agree, ask why, ask questions, investigate. But every person was trained for their job and their role, and every person has seen things, and so they know. So everybody is important.
Love it. Yeah, you got to trust those 30-year experienced nurses because they've been there. They've been doing it.
Yeah, but even those nurses who are newer, some of those newer staff members, they have ideas that maybe you haven't thought of because that's not how you were trained. And so recognizing that there's a reason these people work here, there's a reason these people are here on this team. I think that's like the biggest piece. I know that sometimes it's hard to work with residents at a teaching facility. I get it. But they have experiences that I haven't had either. I mean, when you got your stitches, you didn't have a great time. And so if you had said to me, I, as a patient, really didn't like laying down. Is there a different way you think we could do this? I totally would have been like, yeah, let's brainstorm. Where's the laceration that we need to suture on this patient? Okay, how can we make this happen for them? And so having kind of that communication and realizing that everybody on the team has some knowledge that might be beneficial to you is super important.
Totally. I agree completely. Now, if people want to reach out to you or learn more about child life as a career or just have a little chat, how can they reach you?
I can be found on LinkedIn, but you can also reach me via email. And my email address is brielleswerdlin@gmail.com.
Thanks, Brie. And for the listeners, all that information will be in the show notes to make it easier for you. Well, I really enjoyed this talk, Brie. Thank you so much for coming on the show and sharing your insight. And thanks again for all the years at Upstate where you told me not to do certain things because it's certainly changed my career for the better.
Of course. It's an honor to be here talking about child life. Of course, people can reach out to me via email if you're interested in learning more about child life as a profession. The Association for Child Life Professionals has a website, childlife.org, that you can look at to see more information about that. But I'm happy and I'm glad that I got to share this experience in talking about communication. And I'm glad to see that you are doing such great things, Andrew. It's so phenomenal.
Thanks, Brie. I really appreciate it. We'll talk soon.
Yes, bye-bye.
What an amazing interview with Brie. She has an infectious personality and is just so easy to talk to. I guess that's what you would expect from someone who works primarily with children. I thought it was interesting that Brie thought that often people have to advocate for themselves as an important role in the healthcare team, and that sharing her knowledge and unique role could be challenging at times, especially with the turnover at a teaching institution. Brie's point about just being friendly with people was refreshing. She states that just having meaningful conversation with people is paramount to building rapport, and it keeps the humanity at work. She definitely thought that team-based rapport was important and improved patient care. If you enjoyed the show, please check out the show notes at talk2medocpod.com/005. That's talk, the number 2, me, docpod.com/005. Don't forget to subscribe to the show on Apple Podcasts or wherever you get your podcasts, and tell all your friends in healthcare about what we are doing here. The other thing I want you to do after listening is mention me on Twitter at Talk2MeDoc. Talk number 2, me, DOC. Thanks, and talk to you real soon.